Let's join the trend. 5 things that I would never do as a functional medicine provider as opposed to my colleagues in conventional medicine. Now, full disclosure, I used to practice conventional medicine and I used to be guilty of these 5 things, but not anymore. And so to my colleagues, I say it's never too late to evolve. Let's go. By the way, I discuss each of these topics in my lives, my podcast, my YouTube. So whichever one you're interested in, go ahead and find it and get the details you're looking for. Number 5, I would never tell my patient that their thyroid is normal just by running a TSH. Make sure you ask for antibodies, your T4, your T3, the entire thyroid panel to really know what's going on. Number 4, I would never tell somebody who has achy joints or achy muscles that, hey, what do you expect? It's just your age. Absolutely not. I'm 50 and I feel better than I did when I was 40 and when I was 30. And that's because we now know that aches and pains mean something. And it usually means inflammation that hasn't been treated. So don't accept that as an answer. Number 3 is to tell women with irregular periods to just go on the pill because there's nothing to do about it. There is so much you can do about it. And most importantly, you have to get to the root cause of why your periods are irregular instead of just medicating. Number 2 is tell people with brain fog or certain memory issues that it's fine, it's your age, and there's nothing really to worry about unless it gets really severe, and that there's nothing you could do about it anyway. Totally untrue. There is so much you could do around brain fog and around cognitive decline that has to do with diet, anti-inflammation, and something called nootropics, which if you don't know what it is, I need you to Google it and find out because it's a big deal. And number 1, I would never, ever tell someone that their symptoms are in their head and that there's actually nothing wrong with them. And I feel so strongly about it that I wrote a book called It's Not in Your Head. So whether you choose to buy this book or not, what I want you to know is your symptoms are real, they mean something, they're not in your head, and they need to be addressed. I hope this helps.